Okay, so let's talk about the development of the esophagus. And if we look at these structures here, so this part in green will represent the gut tube and the proximal gut tube that will form the esophagus. And from this part of the gut tube, actually, we will have an outgrowth which is called the respiratory diverticulum, which is represented here in purple. And this respiratory diverticulum will grow from the gut tube and form the trachea, the bronchi, and the respiratory tree. Okay, so in which direction are we looking here? So, as we know, the trachea lies anterior to the esophagus. So here we are looking from the side of the embryo. And if you look from the front, of course, the trachea is going to be anterior to the esophagus, is going to form anterior to the esophagus. So this is the esophagus, and this is the trachea anteriorly. And now let's have a look let's have a superior view, or if we look from above. If you look from above at these structures, we will notice that the trachea and the esophagus are actually, they are widely open to each other, as we can see here. So the esophagus and the trachea, or the proximal parts of the aerodigestive tract, are open to each other when the respiratory diverticulum first buds out. And what's going to happen is that these ridges here are going to start growing a septum, and the septum will separate the trachea and the esophagus. So as we've just seen, at the border between the esophagus and the trachea, two ridges of tissue are going to form. And these two ridges are going to grow and approach each other until they make contact, forming what is known as the tracheoesophageal septum. And this septum is going to separate the digestive tract from the respiratory tract, or it's going to separate the esophagus from the trachea. And here, as we can see, the tracheoesophageal septum has completed forming and has completely separated the esophagus posteriorly from the trachea anteriorly. So this is called the tracheoesophageal septum.